So I am a respiratory therapist, and I work at a hospital in New York, as it was stated. And so that has given me a fairly unique, opportunity and experience with applying Buteyko that I'd like to share with everyone at this moment. So it's given me the opportunity to not only experience Buteyko with myself, experience Buteyko with clients that I work with, but as well, a very unique experience seeing how, on a certain level, been able to apply the Buteyko principles in the hospital, and I'd like to share a few of those results with you. So the first example I'd like to share with you is a client that I was working with, that she was new to Buteyko, and we were in the process of teaching her breathing exercises, what to do to improve not only her, primarily for her daughter, but because her daughter was learning, she was learning as well. Her name is Stephanie, and it just so happened she became exposed to COVID-19 by a family member. And so she had a strong reaction and developed pneumonia and had breathing problems, but she knew enough to apply the Buteyko principles. She applied proning, as Dr. Novozhilov mentioned, sleeping on her belly. She was doing breathing exercises and basically applying the training that we were going over for her daughter, which allowed her to recover from home and not having to go to the hospital. I'll share also my own experience, because I work with COVID-19 patients who are positive, known positive, day in and day out when I'm at work. Fortunately, because of my Buteyko learning and education, I have zero fear when dealing with and treating my patients. And we're in a part of the country where we've had the most amount of COVID-19 patients out of anywhere in the country. And I don't have, when I did my test, I tested negative. And I'll share two more examples very quickly. There was a gentleman that I had spoken to, his name is Patrice, and I had shared the Buteyko principles with him about a year ago. And recently he had some type of exposure, either early on or relatively recent, and now he's tested positive. One thing that was interesting when I spoke with him, he said since I mentioned Buteyko, he started looking into it and have been practicing nasal breathing ever since then for about a year. And even though he's tested positive, he's asymptomatic, no symptoms, comfortable at home, and continuing to practice, and he's on the line today. And I'll share this last example and then have some a few closing points. And it relates to my experience in the hospital. And related to, there's several examples, but one in particular related to our topic today stands out to me. And that was a gentleman who was positive for COVID-19, and he was on 100% oxygen. He continued to have breathing problems, so the doctors decided to intubate him. And intubation means being placed on a ventilator. And fortunately, I was on staff at that moment and was managing the patient. And because I had a good relationship with the physician that was managing the patient, I was able to have some input, and he respected my opinion. And even though the doctors had a certain approach, I very immediately initiated some of the principles that Dr. Novozhilov was speaking about, and that was low volumes opposed to hyperventilation. And relatively in a short period of time, because of that approach, we were able to decrease that person's oxygen from 100% off the ventilator to like 60% on the ventilator, which is not typical what you see with these COVID-19 patients. They tend to require high ventilation for a long period of time, especially when inappropriately ventilated. And it's known, as Dr. Novozhilov mentioned, that patients, who are COVID-19 positive who get ventilated, 80% of them or more tend to not survive. But interesting enough, in a certain unit where a doctor was more in tune with not necessarily Buteyko, but the concept of decreased breathing with ventilated patients. And this doctor was the medical director of the hospital. And out of his own words, he said, because of the change in treatment, he's seeing the mortality rate go from 80% to 20% on ventilated patients with COVID-19. It had a significant impact, not only myself, the people that I work with, but also in the work environment and the way I able to work with doctors and help patients effectively. So once again, to close, it reiterates a strong immune system is the best source of prevention when we're talking about COVID-19. But also it's the best way to recover if you do have COVID-19. And with my experience, the best way to develop a strong immune system is using the Buteyko method and applying the principles, not only with myself, with my clients, but also with the sickest of the patients that I've dealt with. So just my last point, and that is, it's important that you don't believe everything that people say in the news or friends or even healthcare practitioners. And why is that? Is because they have no reference point. But fortunately today, we've all been given a reference point, a new reference point. And so my last comment is that, so it's important for all of us to use those reference points to maximize our health. And so, it's important to use it, take advantage of it, because your health deserves it.